should patients be even finding clinical trials? Where do they go to see what the options are?
Yeah, so most academic medical centers, and there are academic medical centers in most states, in some cities, multiple academic medical centers. You'll know those because they're often attached to medical schools, although not required to be. Um, Focus on clinical trials because the focus of an academic medical center is not just to give the best treatment for the patient that they're facing, but also to develop the best treatment for a whole group of patients who might have the same problem. So one way in which you can find out about whether clinical trials are right for you is to ask your oncologist about what clinical trials are available. And if there are not a lot of clinical trials at the place where you're going, ask for a second opinion at an academic medical center, which likely has clinical trials that might be available to you. There are also resources available on the internet. There's something called nci.gov, which has a listing of all cancer-related clinical trials, which you can find. Many academic medical centers have websites that you can Google that list the clinical trials that are open. And the Melanoma Research Foundation has a clinical trials website called melanoma.org, which you can use to find out what melanoma trials are available. And it may not be easy to tell for sure which trial is the one that fits your particular need, but you can get a list of them, and it's good to come to an oncologist with a list of trials that you've read about that you think you might fit and ask the doctor whether this is a good option for you, and have them explain why it is or why it isn't. And if you really want to participate in a clinical trial and there isn't one at the place you're at, then I think you can use these resources to find out where some of the trials that you might be interested are actually being provided. And if there's another place that's easy for you to get to, it's a good idea before you start treatment to get all the information you can. I'm fond of saying, we get taught all the time how to go from a particular situation to what is the best treatment option, but it's really hard once a patient has started treatment that may not be on a clinical trial to get them onto a clinical trial that they could have been eligible for before they started. So you need to have this information before you get your treatment if you want to go on a clinical trial.
I also think, patients are often crowdsourcing these days, so they can talk to other patients. They could talk to patients in the waiting room or other patients that they encounter through disease-specific support groups or, online. Of course, there's various channels that people could dial into to get to find out what other people are doing. But then ultimately, I always encourage people to make sure they run those options by their medical team. Not all clinical trials are available everywhere. So some you may have to, they may not be at your local place. You may have to travel for those.